I feel there has to be some uniformity amongst all schools. If if one of the school is accepting the child, the parent will naturally take that child to that school. If some school is saying like, okay, I want a doctor's report, then they may hesitate, they may think twice to bring that child, because there's another school does not want any report but willing to accept my child. They don't want to see what the report is, they don't want to know what this thing is. But you have, it's not about the school alone. For these children, you have to work in tandem with a medical institution. It has to be with the hospital, with the pediatric developmental doctor. It has to go like this. It's just not the school, it's a triangle actually. It's the doctor, it's the therapist, and doctor's team includes actually 4 people. For my son, the assessment was done by a psychologist, a speech therapist, an occupational therapist. Then the doctor will give. That doctor actually took they had a discussion, and that he took opinion of all these people, the nurses also, and then they came to a conclusion. Because the mental disorder, whatever, it can vary, it can be like individual. So they don't want that. The final report that you give out to the parents has to be consistent. It has to be of everybody's opinion. It cannot vary because the parents cannot go from one doctor to another or one therapist to another. So that's how, even when you're recommending, because the school that recommended me said she wants it from a very renowned institution like NIMHANS or something like that, because you will find these therapists and therapy centers also in every nook and corner, just so we really don't know what it is. Psychologist also, you cannot have like that kind of opinion, just individual opinion. It needs to be under the guidance of a doctor. That's what, from my experience, they may be right, but it has to be. If you are doing it, then you will have to make sure that most of the schools accept this. Most of the schools accept this, that we cannot take this child because it's going to harm the child. It is going to harm the child. And I can understand, because I have a group of parents where, I'm trying to tell the parents that the parents have to work. It's just not therapy alone. It's not the school alone. You have to take the child for shopping. You have to take the child for anywhere, pick trips. We have to organize, and I'm trying my best, but like you said, it's very difficult for parents to come out and just do that thing for one child, even if it's a single child also. So what they say is, I have another child, I have to look after him. But it looks like the parents need a little bit of community help and support also in this, and a little bit of counseling from somebody to convince the parents that your child needs help. And that kind of community support is not there in India. If you look at it, I just happened to read in the UK and all, it's very different, because they have community support, that they kind of help the parents in, overcoming this. That first of all, to accept is very, like how I talk, I'm not sure if other parents would even come and talk about this, because it's helping my child. So I don't mind talking. That's what I'm trying to tell parents. It helps. But there's a lot of hard work that parents have to do. Because my doctor suggested to me, now it looks like he is okay, because the child could actually go into autism, the child could be mentally retarded, the child could be hyperactive, and if you don't correct it at around 2.5, and if you don't start the therapy, then he's going to be there for the rest of his life. So actually my child was diagnosed with something else. I said, no, this is not. I'll do anything, whatever possible to stop that, and it has helped. So if it has helped my child, it's certainly going to help. It will help. But the thing is that you will have to work hard. The parents cannot expect somebody else to come and help you, take their position. No, it cannot, because like if the parent is going to work, then probably one of the parent may have to stop going to work and help the child out for some time. I'm only saying for about 8 years. I'm just angry about the fact that I'm trying to talk to parents, and and then they're just not coming out, and they don't want to help their own child. So I'm just a little bit angry about that fact, but certainly not the school. I'm not angry with the school at all.